This particular session is focused towards submission for an oral or poster presentation at a meeting. Abstracts for grants, abstracts for journals, abstracts for other venues, such as a proposal for what you're going to do as an abstract, really isn't the focus of this. So I noticed some of those in the submissions I got, so I'm not going to address those because each of those have really their own nuances. I'll try to mention as I go through some of my initial slides before we get to the abstracts, what some of those differences might be. But even the difference between a poster presentation and an oral presentation are very different, although the abstract portion of it may not be. So that's one of the things. What I want to do is give a few thoughts about what a good abstract for an oral or poster presentation should look like. And then I've selected a handful of abstracts which I've critiqued. Hopefully the people I've chosen won't be too sensitive. It's only to help them with their abstracts. I don't think I'm harsh. I just point out some things that might have improved it. And then my understanding is that you all got all of the abstracts submitted ahead of time. Is that correct? And that each of you were assigned one to particularly critique. Is that so? And so I'll ask you if you want to comment on any of those in a helpful manner, because the person that submitted these probably hasn't yet submitted it to their meeting, so it might aid in improving. So with those comments, my first thought is that the overall impression of all the abstracts is many of them had no title at all. And I'm going to focus on the critical importance of an abstract relative to its title, because in fact, that's all somebody may read. And if you don't grab them with the title, they're not going to read your abstract. And that's particularly so for the situation I'll tell you about in a moment. Well, I'll tell you about it now. So how many of you actually have gotten a bunch of abstracts to grade for a meeting? Anybody? Okay, so very few. So here's what happens. In a weak moment, I agree to review abstracts for a meeting. And then about a week before the deadline, I get 100 abstracts to grade, 0 to 10, or whatever their grading system is. And I start going through them in my spare time. I won't mention when that spare time is, but you probably can vision it. And so what am I going to do? So the first thing I'm going to do is look at the title. And if the title is boring or not understandable or doesn't grab me, it's going to go quickly. So again, the importance of the title for this venue is really critical. Now, an abstract for a manuscript is a bit different. For a manuscript, journal editors have zero sense of humor. So you don't want, for that, you don't want to use a grabber to a certain extent. But I'll talk about the nuance of that. But for a poster presentation or an oral presentation, if you don't have a grabber, you're going to have 3 people in the audience, basically. So the title is really critical. I'll spend a little time on it. I didn't find one title that to me was a grabber. So if I was leafing through these with a short time, probably none of them would really grab me. Almost all of them were pretty boring, in fact. This is what, we academics do, we're boring. And so it's not surprising. But again, for the oral poster presentation, you want to try to get away from that and at least change the title into a question that might grab someone. Something that's, not known that you're presenting and you ask the question. So for instance, I recently wrote an editorial for a journal, and It was about acetaminophen, Tylenol, and whether it had any adverse cardiovascular effects like other non-steroidal anti-inflammatory agents. And so I posed the title in something like, I don't remember exactly, but something like, should Tylenol acetaminophen be added to the list of anti-inflammatory agents that have adverse cardiovascular events? So somebody reading that will say, boy, that sounds interesting, does it or doesn't it? I don't know. And so they might go ahead and read that. So that's the kind of thing I'm talking about, at the least, that you ought to consider. Now, things differ for different national bodies, and some of them will, a few of them might not like that, but I can guarantee you, for this particular venue, you should consider that. Not, something so off-center that, it wouldn't even fly, but at least something that would be a grammar. Now, I remember some titles of abstract presentations, but of talks I've given to physician groups. There you can be a little bit more lenient. This is what I would not do for an abstract. This is really strange for. But to give you an idea of the extreme, one of the talks I was asked to give was the mechanism of arrhythmias, which basically starts with a reentry circuit. I won't get into the details of that. So you can imagine a very boring title you could come up with that, there's the action potential of the frog sarcoplasm altered by blah, blah, blah. My title was, what is the first flight of the Columbia and reentry had in common? And, what was the first flight of the Columbia and arrhythmias had in common? And the first flight of the Columbia, if any of you were alive back then, I'm trying to think how long ago that was, the big question was the reentry of the spaceship into the Earth's atmosphere. And so that's how I tied that in. Now, you probably couldn't get away with that in an abstract, although you might in some images. So that's the extreme, but you can see where I'm going with that. Another one was, what is the Japanese pufferfish and silent ischemia have in common? And so you can see where you can go to the extreme, but I'm trying to get you to think beyond the boring titles that this almost most. Some abstracts were not structured. Now that might be peculiar to your particular national or state meeting guidelines. It's pretty rare these days. Structured abstracts are almost always insisted on, certainly for the majority, the great majority, at least of high-tier journals, they're necessary. And so unless the guidelines of your particular abstract, the abstract that you're given from your national body says otherwise, it should always be a structured abstract. And what I mean, in case you're confused by structured abstract, and the exact structure might differ a little bit, you always need to read the instructions, because if you can't follow the instructions, you won't get anywhere. There's something like background, objective, methods, results, conclusion. So those titled really helps the reader focus. Some of the abstracts that were structured showed that, and I think for those of you that submitted these without pointing you out, you'll recognize this. Some of the objectives were really about a paragraph long, and an objective should be like a sentence or two at the most. So you really need to focus on that. Some objectives have methods or results in them, and so on. And finally, some didn't even list, not only didn't list the title, but didn't have the authors either. So obviously, if you're going to submit it, you need to be careful that your name is prominently, at least your name is prominently displayed, if not the co-authors. So those are some of the overall impressions that I had about the abstracts in general. And this was really pretty instructive. I got these abstracts, fairly recently as you did, probably about the same time. We've got a lot of other competing things going on, so I had to read through these abstracts pretty quickly. And it's hard to be very super critical on each abstract when that's the case. So this was a good example of how the process works. And so some of the comments I've had were really first impressions. They might not even be correct. They didn't even go back to look at it, because the grade I'm going to give that abstract and send in is basically what I got from the abstract. And if I got it, then others will, and that's something you need to focus on making clear if I had a misimpression about it. So those are overall impressions. And let me go through specifics. More often than not, when researchers set about writing a paper, the title is the last thing, and they sometimes do it at the last moment and don't give it much thought. And I hope I made the impression that the title is critical. Now, in manuscripts, the title really needs to reflect what was done. In fact, if you're familiar with the consort guidelines for manuscript preparation, how many of you are not familiar with that? It specifically states the importance of that. So the title does need to accurately reflect what was done. Some examples might be when you're talking about prediction of future cardiovascular events in a cross-sectional study. That's an association, not a prediction of anything that's going to happen in the future. So, when you say things like that in the title, does X predict the occurrence of Y? And then then what your manuscript is about is a cross-sectional study. That's a problem. And you might think that's something silly, but boy, I can tell you that happens all the time. In fact, not only is the title one of the last things that's done, but the abstract is one of the last things that's done as well. That's fine. You can write the meat of the thing, the article itself. The point is, don't give the abstract the title the short shrift. You got to really give as much time to it. And in fact, I'm trying to remember, it's always the credit is always given to a different person. I think it might have been Pascal who said, "I'm sorry I wrote such a long letter, but I didn't have time to write a short one." And the point he was making is, and it's true, to write a short manuscript, to write an abstract of that manuscript, frequently takes longer than the manuscript itself. And each person has their own way of doing it. The way I write manuscripts is I just slop everything down, and then I go and do a very critical edit on it. Some people like to take each sentence and edit it as they go. I don't know that there's a right way, but if you're doing it my way, then certainly it's a lot easier to write a long one than to comb it down. So ironically, the three elements, the title and the abstract, and by the way, the keywords. And the reason the keywords, it took me a while to figure out why the keywords were so important until I started searching for stuff. And then I realized if the author hasn't given proper thought to what keywords somebody might use to search for their article, you might not find it. And that's sad. First of all, it's sad because you spent a lot of time producing this manuscript, and second, because the person doing a review of your literature will potentially miss important things. So really, those are three things, three components that really get sometimes the least attention, and they really need at least equal attention to the manuscript itself. By the way, the abstract, particularly in a manuscript, is sometimes the only thing people read. You don't have time to read the whole thing. So if the abstract isn't really accurate and concise, again, you've lost the opportunity to share your information with others. So consider those things when you're writing abstracts in general. But again, for oral presentations, the keywords are really not the issue, and other things may not apply. But the manuscript does. But grant applications are a very different thing. This really just reiterates what I said in perhaps different words, but I wanted to do it to give you a sense of the importance of the title. So a good research paper title condenses the paper's content into a few words, captures the reader's attention, and differentiates the paper from other papers in your area. And that would apply to an abstract or oral presentation as well. It's got to condense, and by the way, that's another thing that I saw overall from the impression I got from looking at your manuscripts, is the titles were frequently far too long. And for an abstract oral presentation, and even for a manuscript paper, shorter is better. And again, it takes a lot more time to come with a short, accurate title than it does to do the long ones. So keep it simple, brief, and attractive. A good title for a research paper should be about 10 to 12 words long. How many of you achieved that? A lengthy title may seem unfocused and take the reader's attention away from an important point. So avoid, I just pulled out some examples, changed them enough to protect the author's anonymity. Avoid drug X, Y, and Z has an effect of muscular contraction for an hour in snails of blah, blah, blah species. You can pronounce it. If you're in the field, you probably could. Better, to reduce the number of words, drug XYZ induces muscular contraction in these kinds of snails. Short, to the point, still a bit boring to me. I might try to form that into a question. Does drug XY, at least, does drug X, Y, and Z induce muscular contraction in the species of snails? Or, you know, if you're in the field, you could perhaps think of something a little bit more catchy than that, but at least something like that. And I use appropriate descriptive words. So avoid effects of drug A on schizophrenia patients, study of a multi-center mixed group. Better, psychosocial effects of drug A on schizophrenia patients. It's more to the point and straightforward. And again, I didn't give a lot of thought to how I might change these titles further when I pull them up, but at least it gives you some idea how to make it a bit more simple and focused and straightforward. In the title and in the abstract in general, use as few abbreviations as possible. Now, I know you have word restrictions, and so abbreviations are done throughout. Put yourself in the place, particularly if it's not a highly specialized group that you're submitting this to, but a more general group. So I'm a cardiologist, so let's say you're submitting to the American Heart Association. Within that group, there are going to be generalists, there are going to be people that are highly specialized, there are going to be people in between. So you ought to put yourself down somewhere in the middle if you're in the highly technical group, and sort of think about, would they understand this abbreviation? Would I understand this abbreviation if I were not directly involved in the field? And try not to use it if the answer to that is no, I wouldn't recognize it. Now I know you say, well, you use the abbreviation the first time you use the full title. I know you're reading the abstract, and every time you come to that abbreviation, trying to find, you know, going back to where they originally said what it was, is problematic if you want somebody to read the abstract, particularly if you're a grader and want to, you know, go through it quickly. So be careful about that. So here are two titles I pulled out of your abstracts that I thought were particularly long, a bit confusing, and used some abbreviations within the title itself. And in general, you probably want to at least avoid abbreviations in the title. Now, I know why you do it. I do the same thing. You want to get away from having to repeat this sensorineural hearing loss in the abstract every time you use it. So if you use it here, then you can get away with using in the abstract itself. So instead of 3 words, you've got it down to basically 1. And that helps you with the number of words. But if you're going to really pay attention to shortening your abstract in general, then that shouldn't be a problem. And by the way, Some of you, I ran word counts on each of them. Some of you had abstracts that ranged over 500 words. That might be fine if the particular body you're submitting the abstract to allows that, then fine, there's no reason you have to restrict yourself. But in general, 250 to 350 words is what most bodies use. And if you're submitting it for a manuscript, it may be 200, and I've even seen 150, and even the occasional 100 words. So you really need to be careful about word counts. There was no way for me to know if the ones that used 500 word counts, if that was allowable or not, obviously. But if not, you probably won't even get the abstract to me. It'll be discarded before it gets sent to me. So here are two that I thought were particularly long and not very catchy, and certainly not grabbing. And again, depending on the venue you're submitting it to, you might want to work on how to improve that to something that's a little bit more feasible. I wasn't familiar enough with either of these areas to really be able to, nor did I have the time to be able to work on this. Something I would certainly encourage you to do if you haven't submitted it already. Now, I came across one abstract that didn't have a title, but had something called a running title, which, as you know, is a shortened title that is frequently used for manuscripts for each page or every other page to have a title. Having said that, I thought this was a great full title. Physical activity with aging and HIV. What more do you need to say? That's what the abstract was about. You might, again, as simple as forming it into a question. Does physical activity with aging in HIV patients, is that physical activity altered with aging? Something like that. So again, think of short rather than long. By the way, as I remember, this abstract wasn't about aging associations, but just what was found in older individuals. So here there would be an accuracy issue, if my impression was right. They made the deduction that by studying older people, they could talk about physical activity, the physical activity in older people with HIV. They could talk about what happens with aging, which is what this title would imply. So this would have to be altered, the title, to reflect the fact that, so I would say physical activity in older individuals with, so again, the person who wrote this is in the audience. These were my impressions, correct or not, that I got from reading the abstract, hopefully as a grader. So wouldn't have gotten a very good grade. Here was another one that I thought could be changed a little bit, but I like the idea of missed opportunities for trichomonas diagnosis and treatment in the urban HIV clinic. See, that to me is a little bit more catchy. Missed opportunities. That suggests something that I might be interested in, rather than if you did some kind of long title that really didn't have that in it. And so that was an example of one where I thought the title was a little bit more grabby. These make sense? Okay, now like the title, considerable thought should be given to its content. For most journals, well, I mentioned this already, 200 to 350 words. So one needs to carefully read the instructions of the author section. If you don't, nowadays when you submit it online, if it's over 350 words and that's their limit, they won't accept it. So in the past, you'd send it in and then they'd get it rejected because it's too many words. At least now you can't even get it to submit it if it's not meeting that. And as I mentioned, it frequently takes longer to, frequently takes longer to write the abstract than does the manuscript itself, because it's harder to write such a short and long. So a structured abstract, I mentioned, the title should reflect what the abstract is answering, but should be catchy for this venue. Background objectives, sometimes they're included as a one title, sometimes they're separated. The background shouldn't be obviously an extensive review of the literature, but a one or two word sentence or sentences about why you even did this study. The methods should include, are you familiar with the acronym PICOS or PICOS? Population, intervention or exposure, control group, study design, what did I miss? But anyway, those are the things that should be in the method section. So population, what was your exposure or intervention, depending whether it's an observational or randomized control trial or clinical trial, what the outcome is, what the control group is. Oh, that was the O I missed, outcomes. And then what the analytic approach was. So that's what should be in the methods, and I might even consider structuring along the PICOS or PICOS what do you call it? Mnemonic. If you remember PICOS, if you're using exposure, PICOS if you're using intervention, otherwise same thing. And then there's a results section and a conclusion. And the conclusion, again, should be one sentence. And should avoid editorializing, particularly for something you're studying in the show. You know, I found a cross-sectional association between X and Y, therefore this intervention might be good to prevent future cardiovascular events. Well, you didn't study that. So, I avoid that kind of, sort of a promotion of the importance of this study. People will be able to draw that from their own experience, but be careful how you say that in the conclusion. Or words like, well, I don't remember, there was one abstract I came across, I think that pointed out that sort of editorializes and promotes the importance of the conclusions, perhaps far beyond what the abstract actually covered, or the study actually did. So remember, for manuscripts, there are a number of guidelines that are used, the consort guidelines for clinical trials, STROBE for observational trials, PRISMA for meta-analysis of clinical trials, MOOSE for the meta-analysis of observational trials, and then for genetic association studies, another guideline. And these guidelines are increasingly being adopted by journal editors. And so when you're doing these kinds of studies, you should follow these guidelines. It'll be not only to your advantage so you don't forget to say things, but it'll probably be important in terms of getting the manuscript accepted. And almost all of them talk about the importance of what the title should be and what should be in the abstract and how the abstract should be structured, as much as how the manuscript should be structured. So again, depending on space, and particularly for oral and or poster presentations particularly, the poster presentations are in ways even more restrictive than our oral presentations, because you have 10 minutes to talk about what you actually did. In a poster presentation, people are wandering by. First of all, if the title doesn't grab them, it's going to be, how are you today? Nice to see you, and on they go. And second, how the size of the title should be. And in a good poster presentation, the title should, I'm going to be silly and say take up half the poster. No, but a lot of it should be big enough to be seen by people who are walking by 10 to 15 feet away. And remember, a lot of them are old codgers like me, and 15 feet could be like, across the football field for some people. So you need to really have something that's going to grab their attention and also can be seen. But if space permits, things like the dates of accrual may be important. I like to know when I see a study presented, was the population recruited between 2000 and 2005 or between 2010 and 2014, because things change over time. History of diseases, the natural history of disease changes, and it may make a difference, and certainly in some. A description of the statistical analysis for randomized control trials, you should mention whether intention to treat analysis was used. Intention to treat analysis is, you should, I talked to you about it. Patient attrition, so if you could fit a small patient flow diagram, or at least mention, it started with screening 400,000 people, and I studied 4,000, might be an important thing, and along the line, here's why I lost these people. And then if there are any pre-specified secondary subgroup analyses, that's nice to do. Now, if you can't fit all this in, particularly for a poster presentation, what I keep trying to tell trainees when they come to me and say, here's my poster presentation, what do you think? Is shorten it, shorten it, shorten it, and then just have a handout with all the other stuff. Because in a poster presentation, that's very easy to do. There's a lot of stuff that you could present. You don't have time, so just give them the handout. Particularly if they ask a question, well, yeah, I couldn't fit that on a poster, but let's go over it here. And you can do that with an oral presentation too. You can have handouts at the back of the room for them to take when they leave, for those who are interested. Generally, what you shouldn't report in abstracts, at least, are results of secondary analyses that are not pre-specified, and results of subgroup analyses which are not pre-specified, because those are, if you interrogate the data enough, you can get it to admit to anything kind of analyses. And those after the fact things may be important to generate future research questions, but they're not very important in terms of what you can take home as fact or even near fact. So those in abstracts should not be reported. Should be reported pretty softly within the manuscript itself, but with abstracts, that's stuff you want to leave out. This is kind of stuff you want to put in if you have room. If you don't, then you don't. Some things to consider. Oh, forgot I put this up. This is the PICOS thing that you can follow within your methodology to hone in on what's important. Another thing about abstract oral and poster abstract presentations is that I would hope that most of you do this work ultimately to produce a manuscript, to add to the knowledge base of the human knowledge base. So I would think, since once you've done the work and written the abstract, actually writing the paper, if you do it that way, is not very difficult. In fact, most of the time, you have to write the paper to do the abstract. So you've already done most of the work, and why in the world it wouldn't ultimately be published unless it really stunk? If it really stunk, in general, it doesn't get to, at least the major medical meetings, doesn't get to oral presentation. Yes?
You tend to see a lot more negative findings at meetings that are published.
Yes. The issue of negative findings is another one, and I'll mention that in a moment. So it's interesting that despite what you would think, that we find, this was from this particular analysis, the authors say we find it perplexing that 2/3 of abstracts following presentation at a major medical meeting, 2/3 will not be published within a 2-year period and only 40% within 5 years. And that to me is rather astounding, since you've done most of the work already. Generally, maybe what you're doing is adding a few more, sample size to the study, but that shouldn't take 5 years. So it really is, and this was a fairly recent analysis of this. And in fact, even abstracts rejected for presentation have a 1 in 4 chance of being published ultimately in some journal. So just because it was rejected, don't get disheartened either, because remember what the process is. It's somewhat like a peer review process for a manuscript. It's pretty much a crapshoot, isn't it? And then whether you get the right reviewer or not, and, sometimes they just had a fight with their wife when they're reviewing your manuscript, and who knows. So there are a lot of things that, and it's just, basically 2 peer reviewers in general, sometimes 3. Sometimes the editor will read it too, but usually not unless there's something about the reviews that make them want to read it. The same thing with the abstract, even more of a crapshoot, because as I pointed out, the process really is sometimes rather random and not a very good one, but perhaps the best we can do. So don't lose heart just because you weren't accepted to a journal and just because you weren't accepted for abstract presentation. Some of the manuscripts I ultimately published after multiple rejections are now some of the most often quoted ones. So just because it's rejected by a number of journals doesn't mean a whole lot. Journal reviewers, it's catch as you catch can, and sometimes the editor feels it's just as appropriate for their particular journal. There are a lot of things that go into it. So, keep trying if you think it's a reasonable manuscript, and usually they'll give you some good critiques, so you can decide whether it's worthwhile pursuing or not. Among abstracts accepted to the European Society of Cardiology, the subsequent publication reached 38%, and for rejected abstracts, 24%. So perhaps not as big a delta as you might have thought, as an example. Negative study abstracts will rarely get accepted. One of the things that marks negative study abstracts, particularly to a major medical meeting, one of the things that marks negative studies is they're usually small sample sizes, and the only way you can overcome that is with a bigger sample size, and even then, it's always questionable because the whole issue of negative studies, which I can't get into now, is the problem. Some have championed the idea of a journal of negative studies for that very reason. As with, I guess, nobody wants to invest on the success of that kind of journal, but it's something to consider. But if it is accepted, then negative studies might be something that is going to be much more difficult to ultimately get published, particularly if it's a negative observational study. Negative RCTs, particularly if it's a big enough sample size, are much more likely to get accepted because the likelihood that it's truly negative is a little bit greater than observational studies. So in looking at this time between abstract presentation and publication, this author found that 510 randomized trials, 26% were not published within the full 5 years after presentation of the meeting. That's rather striking because remember, in a randomized trial, you're actually controlling an intervention which some patients get and some don't. And to not publish those results is almost a breach of contract with the patient. So those are particularly important to publish, not that observational studies are not. 81% of these studies with significant results had been published, but only 68% with non-significant results. So again, this is the negative study, and it is less likely to get published. But still, for a randomized clinical trial at least, not bad. Oh, I said that. And this breaks down the whether the outcome of the study was significant or non-significant or really null, and whether it was published, presented, published only, presented only, or neither. And as you can see, obviously, the statistically significant studies all had higher likelihood, unless neither was present, obviously. And I won't go into this in any detail, but you can look at it in your handout to look at reasons that the studies weren't published. Let's see if there are any that particularly stand out. Yeah, I guess this one is an interesting one. A lot of times you're doing this in your training, and then by the time you get out of training, if you go into clinical practice, you get too busy or lose interest in really pushing it. So that's one of the reasons this happens. If the results aren't particularly important, that you'll lose interest. The importance here is, if anybody's talked to you about meta-analysis, is that publication bias to publication of only positive studies is a particular problem. In fact, it's the main confounder in meta-analyses. And if you think about it, if the negative studies aren't published, then all you have is the positive studies that you're reviewing in the meta-analysis, and guess what? The meta-analysis looks like the intervention, its intervention is much better than it actually truthfully is. So you should try to publish what you do. So remember the PICOS thing. If you do that, this won't happen. But in this review, I mentioned 510 abstracts. Almost a quarter of the abstracts failed to provide explicit identification of the problem of impact. Well, that's really why you're doing the study, so that's rather striking. Here's some abstracts. I not read through word by word, but just to show you. This was 211 words. High stress levels predict coronary events. What a great title, huh? Not a whole bunch of, type A versus type B behavior and, blah, 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 and da, 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 and, 20 words later, you're still trying to figure out what to study. High stress levels predict coronary events. What could be better than that? Yeah, the study actually showed that. If it didn't, you couldn't say that. You could say does not if it didn't. Background, perceived stress may increase risk for coronary heart disease and death, but few studies have examined these relationships longitudinally. Great background. Objective, to determine the association of perceived stress with incident CHD and all-cause recovery. Straight, focus, there's no question about what this study is. I won't go through the design and settings, but main outcome. So there's no question about the primary outcome. The results in a one-sentence conclusion. High stress was associated with greater risk of incident CHD and death for individuals with low but not high income. Yeah.
The question mark as a bacteria catchy or the more catchy?
I'm sorry, I can't.
Sorry. The question mark like each high
I'm sorry.
I'm saying if you put a question mark like these high stress level predict.
Yeah, okay, that's fine. Then you can make it even more catchy if you want. But at least this is focused in 1, 2, 3, 4, 5, 6 words. The abstract is 211 words long, and everything you need to know is in there. This was not mine. I didn't choose this. This was somebody else's. Do non-hypertensive offspring of hypertensive parents have echocardiographic abnormalities? So here it's posed as a question. Well, let's see. Doesn't really get you thinking. This is 187 words long. It was a very complicated study. This is mine, in fact. Again, amazing what you can say in a few words. This study shows that in a large population-based cohort of non-hypertensive offspring of hypertensive parents, ethnic differences in hemodynamic and echocardiographic profiles exist. Very, very straightforward conclusion, not collaborating, not promoting, self-promoting. This is what we found. And in 187 words. Okay, so any questions about what I've told you? All right, why don't we take our compulsory 10-minute break here, and then we'll go some abstracts themselves. and then ask you for any that you've looked at that you want to help the authors with. Yeah, actually.
They're both not
So I didn't, I completely had a different idea of what this process was.
Okay.
Yeah, so in the future, I signed up with you. Format, and tell if you want something for a meeting, right? So I wrote it as, here's an idea, turn it into a clinical trial.
Okay, that was not, I did a lot of reading, so,
Yeah,
you know, we don't have to read it particularly.
yeah.
I'm not sure, you know, we have a chance for feedback.
Yeah,
So,
yeah.
we're
We
getting
get
back
back
a
all
lot.
forever, yeah.
So,
Yeah.
you know, we have ideas.
How many abstracts are we looking at?
I'm looking at 4, and then we'll look at wherever you want to bring up.
I have one that was emailed to me
Huh?
that I should.
Yes, if you, we'll have you talk about it.
Yeah. You only got one email
Yes.
to use?
Yeah.
Some people got all of them.
Yeah, and then this one.
Yeah, that's all I got.
So you can look at the test, and on the canvas is a Microsoft Word copy of the test. Spend as much time as you want answering the questions. And then when you open the test, just take your answers in within 2 hours. Fill it in. So it should be right on canvas. If you don't know, if you can't find it, do you know Florence Louise? No, just email me if you can, now that you know it's there. See if I can pull it up here. Show you what it is. But if you can't find it, email me and I'll get you in touch with that person.
Yeah, because we didn't, I think the lecture when we hear didn't include some very detailed discussion about it. So we saw
Okay, I can't get on because I just got this phone and I haven't configured it yet. Yeah, just look on Canvas if you can't find it. Let me know.
So we should be able to download a Word file, you know,
Right.
how it works. So I only have one thing.
Yes.
That's really helpful.
Cataract surgery within the last 6 weeks, so the surgery was held. You get
So what I'm looking
everything,
at
you know, so I've never used these before.
yeah,
You see, one eye, the other.
so they do one at a time.
Yeah, they did, but
Right.
they did one, then I realized, because I had very high corrections. One eye, I see it great, the other eye is-
That must be very much.
Oh, God, it was horrible. Trying to read, that's the big thing.
Right.
Sort of big problem. And so it's,
Yeah, I'm
but
facing
that's
that.
what helped. At the end of this month, though, I will be stable enough to do anything I want.
Good.
Jeez.
Yeah. I'm still a year off of that, I think, but I've had to.
Well, I'll tell you, I've got 6 weeks off. Because it's just, the surgery is like nothing.
How soon did I let you drive and stuff after that?
Well, I could see better, you know, with just one eye.
Right,
But I did it before.
right.
So, yes,
So that was okay.
your depth perception is a bit off, so you have to be a little more careful with that.
Yeah.
Whereas acuity is actually better. Yeah, and then the second one, the big thing is, I think it's a grade 4. I think it's like the emergency as well.
Right,
Reading, because it keeps changing.
right,
You know,
right. Right.
so it's not fun to do exactly. So.
That's good. There's so much you can do to expand the font size and still be able to actually read it. It's yeah.
Okay. Definitely close. Okay.
We're getting close. You got 1 minute according to my watch.
I don't know what that is. That just.
It's just where the cursor is.
Good.
Ready to go? All right, so I selected 4 just randomly. By the way, I was just telling Dr. Chaplin as I was reviewing these manuscripts, I've had cataract surgery in the last 6 weeks. The surgery is nothing, but trying to see properly is the big thing after it until everything stabilizes. So I was not in a good mood when I was doing these, but I said, don't get sensitive. I don't think I said anything harsh here. I was just trying to make some comments about things I saw. So I'll present these 4 in my views, and then for those of you that were assigned any of these 4, if you want to add some comments, please do. It will help the authors. So this one, first of all, the title, Methods of Glycemic Control in Pre-Gestational Diabetes Receiving Antenatal Corticosteroids. So I thought this was, you know, good, short, and focused. Could be a bit catchier, I would think. But again, it's not my field, so, you know, I didn't want to work on that too much. But give some thought to it. Or maybe, you know, posing it in a question or something a little catchier. But overall, I thought that title was nice, short, and focused, so that one I would sort of stick with. The objective overall, to me, is a bit long. This is also an objective and background combined that may be unique to the particular abstract guidelines. If not, I would have separated them and had the objectives, just this last sentence. We aim to determine how well diabetes was controlled with natal corticosteroids, and if there's management option which improves control. That to me would be the objective. This other is background, and I might have even shortened the background to, there are no guidelines for glycemic management in pregnancies complicated by diabetes receiving ACS. That's all the background you need for an abstract, and if you're short on words for the rest of it, that's a good way to eliminate a bunch of words. Because that's the background, and that's not going to be adequate for a manuscript where you're reviewing it, but for the abstract, it certainly is. I found some words that, you should really be careful about reading it and being very, you as the author, be very critical on each word and whether it's useful or not. So this originally read, all of these patients were inpatients at the time of antenatal steroids. All were inpatients at the time. You don't need all of the patients were inpatients. As an example, how to eliminate words, be very careful about editing. There was a change in tense here. You should keep the tense the same throughout the abstract, not a big thing, but important to do. The conclusion, let's read that. Overall, glycemic control was inadequate in the vast majority of mothers. Those subjects who received continuous insulin infusion had a slightly better glycemic control. Options to improve glycemic control after include insulin drip, perhaps adjustment of intermittent insulin doses warrant further study. So that's okay. That's not promoting too much. What a lot of people would say is something like this study suggests that adjustment of intermittent insulin doses are beneficial or could be beneficial, which one that was not really studied. So this says it okay. It might be a little wordy, but these are some of the minor things I thought could improve this particular abstract. Is the person who did this, yes?
No, I don't have any comment. It's fine.
So nothing further to add? Okay.
It got rejected. So,
Well, I mean, so.
we're
Good.
working on making it
But it
better.
was just an abstract. They didn't say why they rejected it. That's fine.
I just noticed one thing though, in the results section, it says ASC, and I think your abbreviation is supposed to be ACS.
Oh, yeah, thank you.
Oh, good pickup.
I had a question in the title.
Yeah.
What is receiving antenatal corticosteroids? Like, are the women receiving it?
Yeah,
Okay, it doesn't say that.
okay,
So it's a little bit,
In what receiving?
yeah.
so if you read it, there's no object to the receiving. It's vague.
I see, okay. I don't know, that didn't bother me, but again, some of that's somewhat subjective. Okay, let's look at another one. All right, I thought this title was long and certainly didn't catch my attention now. Granted, this is about as, well, it's not as far from my specialty because this is about coronary artery endothelial cells, but I just would give a little more thought to what to how to make this title a little more interesting. I didn't really immediately come up with any ideas. If any of you have some, please help the author.
Fix the misspelling first.
Oh, by the way, that's true. Spelling is, you should always do like I like to say, a spell check, S-P-E-I-L. You always do a spell check on things and look it over carefully for that. Although I'll tell you for an oral abstract presentation as a reviewer, you're not gonna have time to even look at spelling, so probably that'll be missed, but ultimately it's gonna be important. So there was a spelling error here that I did pick up, even though.
First word.
In edition, good. That's bad. In the title, it's not particularly good, is it? So I give some thought to the title, certainly do some spell checking. Oh, here's one these provocative findings, see, that's the kind of thing you want to stay away from. I didn't find it all that provocative personally. And so that's, that's an author trying to self-promote the importance of this, which is fine. It's fine to feel that way, but those kind of words you should steer clear from. It'll turn off reviewers for sure. And then they talked about coronary artery and stents, but they said, again, a spelling error, prevention and treatment of cardiovascular disease. And cardiovascular disease includes stroke, aortic aneurysms, peripheral vascular disease. So you got to be careful about what you're really talking about there. If that was your implication, that's fine, but I don't think it was, having read it. So those are the kind of things you want to be careful of. The person that reviewed, oh, and it's not structured either, which may be, is the author here?
I have a question about this.
Before you do, is the author for this here?
That's me.
Oh,
Yeah. No, so my question.
you're Dr. Chen.
Well, I'm.
Okay.
I have a question. So my boss and I actually had an issue. He wanted to keep in all of the results, like the actual numbers. I thought it was a little too much.
Mhm.
What is your opinion on that?
Okay, so first of all, before we address that, did they specifically say don't do a structured abstract?
Oh, no, so this is so we submitted this to ASH and it was accepted, but but it was structured and said this was a different draft that I had.
Oh, okay.
I had edited because we had more data after ASH.
Okay, so yeah, that's an interesting question, how much data you should put in here.
But Dr. Chen really wanted all of that data in, and I thought that it was a little much, and he and I went back and forth, and in the grand scheme of things, we won. But my question was, what is the actual,
So if the abstract allows for a table, then that would be one way I would address that, because it's very hard to read this otherwise.
I found it very distracting.
I agree. So many abstracts do allow a small table, I would put it in the table. Having said that, if it doesn't allow a table, to not have actual data could be problematic. Because otherwise you're just saying that the reviewer has to believe what you said. And of course, how you interpret data, as you might well be aware, is not everybody interprets it the same. So I can see the call for having the data, but if it allows a table, that's the best way to do it. And that table should not be as detailed either. Just pick out the critical ones. So that's what I would do for the data. Is all this data really critical, or is the main point of the thing, and just take the main data is what you should present, and then say analyses of other components followed a similar trend, rather than having all the data. I would agree. This is too much, and I would agree with you. So choose the critical one to mention.
So what other word would you use instead of provocative, like these novel findings?
These findings.
These findings, like cut it off.
Right, I just removed
These are
these
new.
findings.
Okay.
And let the reader decide if that's provocative or
Well, they are new, at least novel.
not. But you've already said that in your objective, hopefully. Novel, new, provocative, those terms,
Outstanding.
outstanding. Stay away from them.
I know Dr. Chen.
Could you go back to the title?
We fight about the title all the time too. If that's any consolation.
Are you gonna go back to him and say, this guy said?
He knows Dr. Glasser too.
So I'm just
How
curious.
about, yeah.
In general, this has a lot of language to specify that specific experimental model and
Right.
that it's pig and, it's how, so obviously if there's an opportunity to use keywords, you can move some of that information out of the title and into keywords to make it easier to read. But in general, do you favor being very explicit about that kind of stuff?
No,
Or being
I'm entitled, I would be general, focused, catchy, grabby, and, but you gotta be factual.
It's a great discovery, matter of fact, those cells that do express interleukin 8, if you put them systemic, they just go to the damaged area and try to fix it. Is that right? So it's pretty cool. So
See
the
what
writing,
data provides.
you know.
You find it very I try to stay awake reading the Bible, so, okay, who reviewed this?
I do actually have another question.
Yeah.
So I guess I'm just bringing up things that we actually talk about all the time. So Dr. Chen prefers us to have like porcine coronary arterial endothelial cells because he wants to be very specific. Could you just say endothelial cells to shorten it? And that's something we go through back and forth because his whole thing is that it's pig and pig, and that's very important. But the question is then, what exactly would you cut? Because
You know,
I don't read about that.
here's how I would approach it. It looks like to me that what you're really addressing is whether the expression of this suppresses
Yes.
neoinflammation. So I would sort of highlight that in your title. But it is specific to this particular model.
Right.
Now, the question would be, and this would sort of be who you're submitting it to. Because you could be too general and say, is overexpressing of interleukin 8 affect neointimal formulation? That could be a title.
Right.
And you leave out all this other stuff. Now, but you'll mention it in the abstract. But to me, that would be a title that would sort of catch my interest. And then you go on and read, well, this isn't a pig model that they did this, yes. If you're presenting it to a body of interleukin 8 specialists, then you might want to have a little more. So it somewhat depends. But in general, this title would be a loser to me. Now, you submitted it like this and got it accepted. Somebody had a great title and got it rejected. This is the luck of the draw. This has nothing to do with whether it's good or not. That's what you always have to remember. Now, in a manuscript submission, you get some critiques back. And some of those critiques are pretty dumb. In fact, and I'll throw this out to you, if any of you get a really stupid review, please send it to me, because someday I'm going to write an editorial about it. And I have some outlandish comments in the reviews. I mean, I've got a good collection, but I need some more. So if any of you get these ridiculous, and you'll get those, and you just say, I appreciate the reviewer's comments, but thus, don't say this was a stupid comment.
So we got one, submitted a paper of science on a nonsense mutation in a gene, and the reviewer came back and said you need to sequence, this was back in the 90s. You have to sequence the whole genome before you can prove that this is an important mutation.
Okay, I'll do that tomorrow, and get back to you, right?
Yes, from malaria.
Yeah. No, I mean, you get that kind of stuff, and so any that are silly, please do send to me. Okay, who's the person that reviewed this one? Yeah, any other comments?
Probably minor. The first sentence, the CCTS intervention stenosis is still an important clinical issue. Maybe to be a little bit more specific, like cardiovascular morbidity or anything. So I'm not cardiologist, so I would just like the first line instead of.
Okay, good. Any other comments? See, I haven't heard anybody say anything about it. Okay. Actually, when I do reviews, I try not to do that either. I try to be, unlike some reviewers, I try to be supportive and just say what things I like and didn't. Okay, here is a study of pragmatic video intervention to promote African American organ donor registration at the Department of Motorized Vehicles. Now, this was a sort of an interesting study, but the title sort of got me lost the first time I read it. Fortunately, I went back and read it. I thought it was sort of interesting, but initially that to me sort of lost me. So how about, can we promote African American organ donor registration with the use of a pragmatic video? Good focused question. I don't know that whether it was at the Department of Motorized Vehicles or not, may be important to ultimately mention. I'm not sure it's worthy of being in the title, personal sense, but this would certainly shorten it, promote it as a question, and be a little more interesting in my view. By the way, the abstract was 501 words. I don't know if this is allowable or not, but in general, again, usually longer than one might think. Okay, here's a paragraph on the objectives. So this, and even that this was being done, so this might have been written for something other than an oral or poster presentation, because this statement in here has really no relevance to a oral or poster presentation. Is the author here? So what was this being?
Yeah, it's an R.
Yeah, see, so again, it was that's what I thought. So this may fit the guidelines fine for that, but for an oral presentation at a national meeting, clearly this is not what you want in objectives. You want what the objective is, and whether it's a K-23 career development award, that wouldn't matter, but for one wouldn't. So that explains that. I thought a 10 to 15 minute video, I'm thinking to myself, stewing in the Department of Motor Vehicles, waiting to be called to get my license and watching some stupid video for 15 minutes, that just ain't gonna happen. I mean, not with me at least. So I don't know if that was something that you talked a lot about, but I think anything more than, 3 to 5 minutes would probably lose most folks. But that might be something you piloted, I don't know. And then you don't get to the comparison group until the very bottom of your the comparison group is pretty critical. So I thought it was particularly important that there was a comparison group, first of all. Because otherwise, as I first read this, they just showed a video to a bunch of people that looked at organ donor registration, and that to me wouldn't have been very useful. I had to read this 2 or 3 times to get to that particular point. They compared it to the capacity, and it was buried way down there. So for me, I would put that up higher. So, oh, it does say is, well, no, it doesn't really. So I didn't know what this was for, but these were some of the thoughts I had. Who else reviewed this? Anybody else? Do you have any questions about?
No, those are very good. Yeah, you write these, and especially for like for an NIH grant, you review it again. And by the end, it reads just the way you want it to read, but that's not necessarily the way that it actually reads.
Right.
It's nice to have external people do it, but I personally find it hard to find people that will invest the time to really give you good feedback for it. I send it off to a bunch of people the comments, and you always get, this is great.
Yeah.
I understand. Again, I want something more than that, give me something to work with. So now I know who to send it to.
Okay, and then the last one, I read them all, but I didn't have time to really critique them all. Oh, this was the one, the title that I liked, Missed Opportunities, because it starts with something that to me was an attention grabber. But then again, this is a combination of background and objective, which is fine if that's what the guideline calls for, some do. The objective studies, the objective of the study, you want to be really careful that you word carefully, and I just had some suggestions to reduce some of the verbiage so that it read more directly. This methods I thought was a little bit scant. Usually I like scant, but this seemed to be a little too scant. But I just thought the wording, I kept reading this and I thought the wording could be improved upon, but I never got to where I improved upon it. And let's see what I didn't like here. This I didn't think was really a finding of the study. It was editorializing what the study might induce people to do, So you gotta be careful how you say that, at least. It's not bad to say what potential significance is, but just be careful about how you say it. And too wordy for a conclusion, and there's some results in here. So the conclusion should really be a one sentence, this is what we found, without any percentages or, data in it. This is what, you're putting all of that into a one sentence conclusion, and then be careful about what you say about the significance of that. So those were my thoughts on this one. Who reviewed this one? Yeah, any other thoughts?
A lot of the same things. Again, I like the missed opportunities at the beginning. It kind of grabs you as an opportunity to change your own practice. The study is more about diagnosis than treatment, and so that's sort of an opportunity to shorten it and tighten up a little bit.
Okay.
Certainly, a missed diagnosis is obviously a missed opportunity for treatment too, but it doesn't talk about how many of these people went on to actually be treated. And I don't know if that's really relevant for that.
No, it is, because, again, I didn't have time to read it that critically, because I didn't do all of them, I just had to do the one. But that would be something that this is what you think that the missed opportunity for diagnosis will result in, is what you're saying, but the study didn't really address that, so I think that's a good point. So that shouldn't be in the title, because the title should reflect what the study showed. And then you might even say,
this would provide an opportunity for improving treatment down the
It might.
The first, 2 to 3 sentences are really a rehash of the conclusions, are really a rehashing of the results.
Right.
An opportunity to shorten and tighten things up.
So is one of the authors of this abstract? Okay.
Yes.
I'm gonna get fired
This is very helpful. I am too wordy, and we are planning, this is a retrospective chart review, and so I just haven't had time to go through all 378 charts to know about treatment.
Mm-hmm.
We got this through the HIV clinic risk database that they already have, but we're gonna have to go into the charts to find out about treatment, because they don't collect that information. And so I do have medical data coming this
All right, you should, does it say it's a retrospective chart review anywhere here? Because you should identify that.
It probably doesn't say that word. The methods, so I need to take stuff out of the conclusion, because it's obviously way too long.
Right.
And we can put some of those words into the methods.
Exactly. Yes, in fact, some of that is methods.
Thanks.
And the remaining, anything else? In the remaining minutes, then, why don't we go through the other ones that each student did, and using work student generally.
I just have a comment to make about the abstract review. When you, like for a meeting, have you done that, frequently for meetings?
Yeah. Although I'm getting smarter.
I did that, I've done it a few times, but I just got on a program committee for a meeting, and I was kind of surprised they showed the data for it. And for this one, it was a survey meeting, so the science, I would say, wasn't, very, very high, very high quality. But they had 5 people review each abstract, and they threw out the high and they threw out the low, and they showed the scores, and they were amazingly consistent across the board. So I've always, for me, when things get rejected, I was like, well, it's stupid, they didn't know what they're thinking about. But the thing that surprised me, because I'm like, well, they're, I know it's not an imperfect system, but I guess that's surprising.
And that's a good point. And they are consistent.
They were.
But some of that consistency is, if your title stinks, it doesn't get any further. It's not that the study wasn't.
Correct.
So.
Correct. And some things I don't think lend themselves very well for abstracts, and other things do, because I've read some abstracts I thought were pretty good, and you saw the presentation like that.
Well, that's another important point, because you submit the abstract, many months before, and then you continue to do the study and you add more people, and a lot of times what you found in the first 20 that you're reporting on are different than when you have 30, and then you have to sort of retrace your steps and say, well, this isn't actually what we found, this is what we found. Yeah. So, there are these things, but everybody understands that.
Yeah. I find some people get their abstracts always accepted too, so
Oh, there's an art.
There's an art to it, and some people are good at it and are thoughtful about it, and for me, I have to work at it.
Yeah, and that's the same for grants. Some people are very good at getting grants accepted, some are not, and it may have nothing to do with the science.
Yeah.
It has to do with how you write the grant. You know, some authors are best-selling books, some authors have just as good information, but, you know, it sells nothing.
Well, some of
How you tell the story.
Yeah, some of what we're talking about is sort of marketing,
Yeah.
you know, and it's.
And when you say that to a group of healthcare professionals, boy, marketing, that's why I went into healthcare because I didn't want to do marketing. I didn't want to sell a used car.
Yeah, I mean, it's sort of depressing to think that marketing has a big impact, but if you think of it in terms of figuring out a way to make it the easiest stuff. So to me, some of the concepts of marketing are to try to manipulate the viewer or the audience, but in this case, we hope it's to try to make the job of the audience easier to understand what the value of what you're doing is, and so that's positive. What you were saying about the process of the abstract review, I mean, it took me a lot of years not to view reviewing as an stomach acid producing event that you're sort of putting your own academic credentials on the line every time you judge something. But, you know, in the end, really the whole process has made me feel like when people disagree, it's usually because they have a different emphasis on what is a sort of crucial thing. And it is really, it's amazing how often people are totally coherent and all have the same general impression of the quality of things they review. I do this a lot, and it's impressive how often.
Just one more comment on that marketing. I just finished taking a class in this master's, but they had this thing I found really fascinating where they did this prospective study where they were trying to convince Congress people, men and women, of instituting changes to healthcare policy and whatnot, and they actually did different approaches and then measured their responses to it. And the end was, you know, if you do storytelling, you know, that they got a much better result. But, you know, they had one that was just the facts, and you think like, oh, very objective and whatnot. That's one of the lowest positive responses. When you put some emotion into it and put, you know, humans in there, which, again, I know it's quite different from this, but I think, again, kind of gets on the make it catchy, draw people in, try not to confuse them with the nuances, because all studies have some nuances that are confusing and whatnot are really important.
Thank you. In no particular order then, any comments on the role of endothelial monocyte activating polypeptide and bronchopulmonary dysplasia? We'll review that one. Nobody?
They'd be missing an action.
Okay. I didn't do a detailed review of this one, but I didn't like the title. I didn't think it sort of got a little boring to me. I would try to word it a little bit differently. It was 500 words. I didn't know if that met the guidelines for this particular meeting, so I thought it might be too wordy. Personally, I don't like 500-word abstracts anyway, particularly if you're a reviewer doing 100, abstracts in a week to grade. And then the conclusion again was more of a paragraph than it was a specific conclusion. So those were the general comments without any detail on that. Was the author of that here? Okay, so we have no review of the author. All right, how about predictors of this was the title I mentioned. Predictors of sensorineural, hearing loss, and neurodevelopmental outcome in infants with symptomatic congenital cytomegalovirus infection. Is the reviewer and or author of that here? If not, we'll just go on. Neither? Okay. The next one I have were guidelines for managed career development award. It's great, but not what we were doing here. Did somebody review that though and want to make a comment?
I reviewed. Thought a lot of. I think it met the objectives that were stated. but I found the sentence structure to be, a little too complex to be easily readable.
Okay, is the author of that here? Okay, I didn't really read this one because it wasn't the focus of what we were presenting, so can't help you further than that. Either the authors are not fessing up or they're really not here. I don't know. Role of apolipoproteins and G2 risk variants in lupus-related end-stage renal disease. Who reviewed that one?
I would read it.
Yes.
I thought it was interesting. I do think that the titles would have been helpful because they were just the three different spots, but I did like at least the breaks in it. It was able to kind of focus me as I was reading it. And I guess they also had a lot of data in the actual thing, and I was curious because, as with my abstract, I was curious if that was what was acceptable or not. But other than that, I thought it was pretty good.
Okay, the one comment I came up with is they were talking towards the bottom there about currently we are utilizing the ROSA 26 gene targeting system. Again, if you're presenting this to a group of geneticists, that might be fine. If it's a more general group, I had no idea what that was. So,
Well, I'm the author. I want to, so the conclusion part might not read like a traditional conclusion part because this is an abstract for a conference called Lupus Update, where they want you to report something in progress. So I was trying to make it more in progress thing, so it's less of a statement than
okay,
direction.
all right. That's fine, again.
Right, but ROSA 26 is a cassette, it's a promoter that people use to drive gene expression in mice. Yeah, so maybe I should just add a few words here, especially when I have space.
Okay, then, usually, again, this may be unique to this particular body, but having a partial reference in there is sort of a little strange.
Yeah, thank you.
I do appreciate that at the bottom it says what the abstract requirement was 300 words, so it was spelled at 256, so it's fine. And then there are no figures or tables, I assume you have figures as well were allowed, so that. And it's not structured again.
Like they want the extra data in there.
Right.
Yeah,
And I'm not sure
that
if
we're
right or not.
yeah. I guess my boss just we don't wanna.
Did they say anything about structured or not?
No, not really. But like since this is modified from a published abstract in which like the journal didn't have a master results section. So that's why this one didn't really.
All right, so this may be off focus of what we're talking about enough.
Right.
But,
Yeah.
so I hope those comments are helpful. Any others?
So I just have,
Yeah.
go ahead. So just a quick question, and this must be because genetics is nowhere near what I know about, but the p-value is given 1.49 by 10 to the power of 9. Is that standard in genetics? Because it seems like every other.
It is, I would say, it's not very, very significant for a GWAS study. That's what people call a borderline significance.
The way that's written is pretty standard in genetics, because it's just
right, yeah, right, yes. But if you read GWAS studies, a lot of times you see like a 10 to the minus 20 something, 50 something.
Okay, wow. That's
Yeah.
information. That's powerful.
Yeah. Also, generally, I would prefer not to say the role of something unless, if you can actually say what the role was, rather than saying the role of, and not telling what the role is.
That's correct, yeah.
It seemed like you have an opportunity to grab people's attention by a specific finding that you have, so.
Right, okay, thank you, that's a good point.
microRNA, chronic lung disease.
I review that. My main comments were that in the background, you kind of quote, if it was here, I don't think it's listed here, a paper, but you don't really, it doesn't really refer to why NER219 might be important in GBT. It just refers to a paper that I've never read before.
So I think it'd be helpful if they just explain the biologic effects of smear 219 instead of quoting the paper. In the design, actually, I reviewed a couple, and neither of the abstracts that I reviewed mentioned the ends of how many samples. I thought that was important information. And down in the results section, they may just not have this result, but they imply a dose response curve for some things, but not for their main finding, which was whether MIR 219 is expressed with this alveolar simplification, like if there's a dose response curve there or not, and that might not just be something that they look at. And then at the end, they talk about two different sentences with further studies, and I think they could just kind of combine that into one sentence to make it shorter and give them a little bit more room in like a background and design and method.
Okay, this sounds like this is a study. There's the author here? This sounds like a study that's going to be done. It hasn't been done yet.
This is somebody in our lab. I'm not on this project, but yes, it just started.
Right, so you wouldn't submit this to a usual kind of oral or poster presentation kind of meeting.
Right, we actually encourage people who didn't have a completed project yet to go ahead and write one like this anyway, so.
Okay.
Matter of fact, it's just interesting. There was the pulmonary symposium the other day, and they did do a poster. So. Not very good.
Yeah, and then there's the project summary we're not going to do. Predictors, we're back to the predictors. Is this another one or the same one? Of sensorineural hearing loss in megalovirus infection. There's a table in this one with some abbreviations that I could not find. Let's see. Oh, that were not described in the methods is what I said. So the table versus the methods to me was a bit of a disconnect. Who reviewed this one? I think we did this already. Did we do this one? I think we did, actually. But this is the one by Rogers, Novak, Rick Fowler. Got any of those people here? Did anybody review this? Okay. The word count, I didn't know it was over 300. And I think that's all I have that we haven't done. Does anybody have any others? What do you have?
I got one without a title. Association through physical activity, I think you mentioned it.
Oh, yeah. Well, that's not here. Association of, read the title again?
There is no title. But we examine the association between physical activity, neurocognitive impairment, and instrumental activities of daily living.
Can you hear me about?
Among older HIV plus persons.
Okay. Oh, okay, so they did say older there, but in the title, I think it said with aging or something like that.
Oh, running, this one had running title, yeah, it was physical activity and aging with HIV.
Right. So any other comments on that one?
Yeah, I had several comments.
Okay.
What is older?
Right.
There's no definition of older.
Older, yeah.
There's no definition of what physical activity really is.
Didn't define physical activity.
Exercising keywords, physical therapy, things that are not in the abstract. And so and we have another term, executive function, which I have no idea what that means. Okay. There's no description of the statistics. But I should point out too that they have a 150 word limit, which I think is ridiculous. So I could keep the journal as well.
Is that author, any of the authors for that? Any others?
I have proteomic profiling of colonoscopy equivalent. Revealed an enriched source of pancreatic protein that mirrors pancreatic juice.
Yeah, I remember seeing that too. I don't know what. Okay. How many did you review?
Just two.
Oh, okay.
I guess there were people that knew they weren't going to be here, so.
Is that any of the authors for that here? Did we ask that already? Okay.
Oh, well then it's probably not that pertinent, but again, just for general comments, they don't have their N in here. And it's pretty wordy, which kind of come in between the two as well, and just thinking about what words you really need in every sentence.
So you thought it was too long?
Well, I think you have a lot of data usually to share, and so if you put like extra words in your sentences, you can't share it all.
Right. And, all right, any other comments? All right, hope you found it helpful, and he's cleaning the fireplace. Thank you.
All right.
Very helpful. I like it. Provocative. Makes me look a little less scared about writing abstract, so more confident.
And she completed
Now
the,
issues.
she completed that course, and her, I read better, like 10 days, or like 5 days.
I actually had a comment on the course abstract that
Sorry?
is the glycemic load.
Yes.
Because I think the idea is nice, it's good, since there are no really good guidance. The study